Okay. Hi guys, and welcome back to another video. For those who are new, my name is Faizaan. I am a second year medical student studying at Anglia Ruskin University, and in today's video we're going through another interview series video where I go and walk through a question to give you an idea of the kind of things that are expected to be said during the medicine interview. Make sure that you like, subscribe, and leave any comments that you have down below, and I'll be answering all of them. So today's question is on roleplay. The question is: you're entering a hospital staff room for 10 minutes prior to performing surgery with Dr. X. As you can see, as you enter, you see Dr. X take a swig of the drink, and when he comes along, he hides it in his locker. You suspect that it is alcohol. Whilst you're having a conversation, Dr. X forgets things and has slurred speech. What will you say to Dr. X? So the way they can phrase a role play is either you describing what you would do in the situation. So this type of question is you're describing what you would say in the situation to an interviewer, and the second type is obviously an actual role play station where you're talking to an actor and you're in this scenario and you're acting out this scenario, and so this is an example of a scenario that you could be given where you either have to act it out or you either have to say your answer to the interviewer. So in this specific example, we're going to be saying our answer to the interviewer. There can be other questions like, for example, talking through. So there can be other examples such as talking through a receptionist and talking through their list of duties and what they have to do from most important to least important, talking through a patient's medications and how to remember how to take certain medications. These are all different acting role play stations that you can get, but this is the one that we're focusing on. So remember to pause the video and do the question yourself before I walk through it. So just a little background, remember again not to speak too quick or too slow. If it is a question where you're speaking to the interviewer, then usually there'll just be follow-up questions. If it is a question where you have an actor present and you're acting out the situation, usually halfway through the interview will probably stop the role play and ask you what you feel you could have done better and what you did well as a follow-up question, and that's usually that's what I had, and that's usually what happens. Okay, so the different points that you can have, these are also adaptable, not only for the acting station, but obviously what you're going to say to the interviewer, sort of for both. So if you're speaking to the interviewer, you're going to be saying things like, oh, I would make Dr. X feel comfortable, talk as normal, ask about how life outside of work is going. He may open up, he may be stressed and have problems outside of work. If nothing is said, then obviously you may have to then probe a little bit further. For example, ask what he's been drinking or why he has slurred speech. You must ensure though that you take care for this doctor, as he may be going through external problems, he may be having mental health issues, he may be having suicidal issues, and so you have to take that into consideration, and you want to make him feel comfortable, and you could maybe suggest counselling if he has any problems. It's important though that you say, if Dr. X admits that he has alcohol, he will not allow to be doing the surgery. He'll have to take the time off, and you'll have to report the situation, because in the booklet published by the GMC, the Duties of a Doctor booklet, which can be found online, there will also be a link in the description. But in that booklet it says that you have to remain honest as a doctor and act with integrity, and therefore you can't allow Dr. X to perform surgery whilst intoxicated, because he can cause harm to the patient. So that's something that's really important to say, whether that is something that you say in the role play where the actor admits that they've been drinking alcohol, then that's something that you say physically to them, as politely as you can, or it's something that you say to the interviewer. If the interviewer said, oh, what would your reply be to this question, that's something that you would say to the interviewer, that this is what I would do if he admits that he has alcohol. It's really important to mention that, because that's one of the main things about this issue, that one of the main problems is that if he is intoxicated, he can't perform surgery on the patient, and you shouldn't allow that to happen, whether he's your friend, whether he's your colleague or not. This is something that you have to report, because patients could be harmed as a result of it. Right, so I hope everybody's enjoyed that. I hope you've understood it. Remember, any questions, leave them below in the comments and I'll be answering all of them. Leave a like on the video, subscribe for more. I'm going to be trying to pump these out as quick as I can and as efficiently as I can. So leave any interview questions that you want me to answer in the video, in the comments below as well. I hope you enjoyed. Thank you for watching.